I wanted to ask because we are at a point in history where technology is taking over a lot of things from all of our day-to-day job responsibilities. How do you see technology coming in and help you with what you are doing right now?
I couldn't run my business without technology. There is no way that I could run my business. I use technology in order to help me to automate things in my business, so that I don't have to worry about that just need to occur kind of in the background regarding contact with clients or managing my timetable or whatever that is. And also I know that for some people it's a bit controversial, but for myself, I am a big advocate for AI and I use it a lot in my business. But I will say that I see it as an accommodation for my needs. And I know for some people, they have various views about it. But for me, I don't think I would be able to do everything that I do in my business without technology and AI support.
Welcome to the Convergence Play podcast.
So thank you so much for joining. It really means a lot. You taking out time and talking to us. And hopefully, we are looking forward to a great, meaningful conversation. And more importantly, getting your story out to the world for what you are doing, what you are passionate about, and how you stand out in your industry. If I think that could be a good starting point. I was going through your company website and this looks like you guys are working on some amazing stuff. So I think it could be a good starting point for our conversation. What was the inspiration between the creation of your company? If you talk a little bit.
Yeah, so the inspiration, gosh, yeah. I guess for me, I had worked in the public mental health system for a period of time. And then I got super burnt out and I decided that I wanted to go into private practice. And when I started out in my private practice, I started getting a lot of referrals for folks that were autistic and ADHD. And I seemed to really vibe with these clients. And then it turns out that I discovered that I myself was autistic and ADHD. And so I went on this massive journey of understanding myself and my neurodivergence and my needs, and then trying to build a business that is much more affirming and supportive for neurodivergent individuals.
That's great. Thank you. And I think uh, you are one of those few leaders who are really authentic about what they are doing. Like you, it seems like what you solve those sort of problems for other individuals as well. So it is really a very powerful cause for a business or something like that. So I think you got it right. So I think this topic or this area you are working on is. I think there are a lot of conventional approaches in my little understanding that are probably not very effective. So what different you are doing in that regard?
So I guess my professional background is that I'm an accredited mental health social worker. So I provide therapy, supervision, and also training. So the way that my practice started, it had a really big focus on therapy. And after working in the public mental health system, and you're talking about some of those approaches that maybe aren't helpful for neurodivergent individuals. Well, I had a lot of experience working within a system that used those. So I guess I really wanted to create a business and an experience for people that was a lot more affirming, a lot more validating, and a lot more supportive for them. So um, everything within my business is neurodivergent people are at the center and in mind. And essentially, I've just refined my business over time as I've come to learn more and more about, I guess my needs and the needs of the people that I work with.
Sure, thank you. So, cathartic collaboration. I was going through a little bit more about what exactly your team works on, and in one part showed up was that you also work with organizations and other workplaces on their training and creating a more inclusive culture. So, uh, how does that is working, and why you feel that part is also important in the long run?
Yeah. So I guess a starting point for a lot of my clients when they come to see me, my therapeutic clients, is that they're burnt out due to work in the workplace. And a lot of them have had these experiences where, they're very capable individuals, but because of not being able to understand their needs or the organizations that they're working with not being able to understand their needs, they're in this constant cycle of burnout and either leaving jobs or losing jobs. And I think awareness around this is you know increasing, which is excellent. But I think it's really important to have like lived experience folks that are kind of driving that, and particularly in consultancy with organizations and workplaces. So I just saw, again, it's just like this pattern of, these clients coming in again and again. I'm going, okay, like there's something here. And, there are a lot of great folks out there doing this kind of work. But I think in the last few years, particularly, there's been a lot more support for people with lived experience. And I guess for myself, with my social work background, I guess I have a little bit of a different lens from a lot of other professionals in my space, because I have quite a systemic type lens, which pairs quite well with a neuroaffirming approach.
Got it. Thank you. So, I think a lot of listeners for our podcast are leaders and industry professionals or CEOs. So, what you would like to recommend if they want to watch out for signs of burnout or neurodivergence in their workplace? What exactly sign they should be looking out for in order to identify that they need more help at their workplace? They need to create more inclusive workplace. What do you recommend to them?
Yeah, so I think with my supervision clients, which are professionals, often social workers, sometimes allied health, they come for support in order to navigate their job or the workplace that they're in. Often, what prompts that is they may be like performance managed or under review for their performance. So, a lot of organizations, they have, KPIs and expected outputs and all these sorts of things. And then it may come to the manager's attention or the team leader's attention that perhaps this person, isn't meeting these KPIs or these expectations. And then if the workplace isn't very aware of the needs of the neurodivergent individual, often these issues keep occurring, and there doesn't seem to be any sort of solution in sight, and then things tend to decline. I think what's really important is, particularly when there are repeated feedback received from neurodivergent staff or just staff in general, where there's sticking points, where they're saying that, it's difficult for them to be able to navigate a particular task or manage their workload. I think often the responsibility can be pushed back onto the individual in order to be able to manage that. But sometimes it really is a systems issue. And when you look at it from that point of view, there might be quite simple solutions that you could put in place, which wouldn't only support neurodivergent folks, but just everyone in general. Might make it more efficient, might make it a little bit more user friendly. So, without having like a specific example, it's hard to kind of be specific. But if I'm talking about, that bigger picture and the patterns that I see, that's what I would say.
Got it. Thank you. Thank you for the very useful and detailed answer. I'm sure a lot of people in other part of the world, I think it's something that everyone should be on the lookout, especially if you are leader and you are in charge of people. Then this can become a big area for you to be careful for. So thank you for sharing your thoughts on that. So I wanted to ask you, how big is your team right now? How many people are working with you, and how long you have been in this business?
So I've had my business for 4 years. It's mostly myself, and I have had some like admin support here and there. So I guess the way that my business runs, I guess I'm very much everything's quite centered around uh, I guess my outputs and my work. But I do a lot of like community outreach or activities where whether that's on social media or that's through conferences or that's through training. So I'm really trying to get out there into the community and being able to increase awareness and education around these topics.
That's great. So I wanted to ask because we are at a point in history where technology is taking over a lot of things from all of our day-to-day job responsibilities. How do you see technology coming in and help you with what you are doing right now?
I couldn't run my business without technology. There is no way that I could run my business. I use technology in order to help me to automate things in my business, so that I don't have to worry about um, you know, things that just need to occur kind of in the background regarding, contact with clients or managing my timetable or whatever that is. And also, I know that for some people it's a bit controversial, but for myself, I am a big advocate for AI and I use it a lot in my business. But I will say that I see it as an accommodation for my needs. And I know for some people, they have various views about it. But for me, I don't think I would be able to do everything that I do in my business without technology and AI support.
That's great. That's really good to hear because, of course, we can either resist this change or we can be part of that. So it's good that you are on that part where you are looking forward to technology as something that can be a great help to you. So if I may linger on a little bit on that, do you have any tools or any softwares that you are using right now for your day-to-day responsibilities?
Yeah, so at the moment, so in terms of practice software, so I use Clinico. I started using that because one of my friends who started their business before me was using it. And it's quite customizable, so which is, I enjoy, but if you're not someone who's savvy in that way, it might be a little bit difficult to set up. But I quite like the flexibility there. In terms of AI, I use ChatGPT mainly, um, and I use Google, so like kind of the Google workspace and suite. So I think for me, having a bit of a hub for everything, not having to go, to this window and that window and this thing and that thing. And, sometimes you have to do that anyway. But yeah, ideally, it's like a full package.
So we talk to many executives, and they are going more and more towards exploring or using telehealth for providing care. So I mean, of course, there are scenarios where telehealth is not very much useful. For example, if you really need in-person visit, but there are a lot of scenarios where telehealth is very much helpful in order to save time and resources and many other scenarios. Is this something that you also use, or it is something in your plan for future?
Yeah, definitely. So, when I first started my business, it was a hybrid business where I still have an office, but have an office and I do telehealth. But over time, a lot of my clients just seemed to transition to telehealth because it was a lot more easy for them to be able to access, and it reduced a lot of stress. Trying to drive, find a car park, come to the office. And I've actually decided in a few months I'm going to transition to solely telehealth, and I'm not going to have my office anymore. Because yeah, I just it wasn't even intentional. It's just over time, my caseload, the people that were seeing me through telehealth, it just grew and grew to the point where maybe one or two people are coming in person now. So, there are aspects of my business, like such as some training and speaking and presenting and things like that, where obviously like in person. But yeah, in terms of my one-on-one clients, yeah, there's telehealth is often preferred.
Do you use the typical video calls, or there is any sophisticated telehealth system that you would prefer to use? Like there, for example, if I may explain that there might be some good solutions out there that automatically creates notes while you are talking to patient, and they give you very good recommendations, AI generated, and saves a lot of time instead of when you are having conversation and in meanwhile you are also taking notes. So they save you all those additional multitasking. So are you relying on those, using straightforward video call at the moment?
Yeah, so with Clinico, they do have a telehealth, like you can use a telehealth platform through that, which is integrated, within your emails and everything that's like client facing when it's sent out when you book appointments. Also use Zoom as well, though, for some things. I guess for myself and my clients, sometimes it's good to have a few options. Unfortunately, Clinico, it doesn't really have AI integrated at this point, whereas the Zoom that I have, the subscription, it has the AI, so you can, generate a summary and transcripts and all this kind of thing. Um, I personally, I know that there's a lot of softwares out there, like such as Heidi AI, and there's a few others that you can like record the session and then like it'll generate a summary or some notes afterwards. I've chosen not to do that because I think for a lot of people, AI is still quite new and they feel a little bit distrustful or unsure of that. And,
For
due to the confidential nature of the conversations, I haven't, I guess used that yet.
Understood. Understood. Thank you. So, I think one big part of, and I'm just assuming, please correct me if not this case, one big part of what you do is going to be probably patient engagement or stakeholders. So you may not only be talking to patients, but there might be scenarios, right, where you may be talking to individuals as well that are connected with that patient. So is this something you also take care of, patient engagement, not only to the one individual, but also their maybe relatives, their parents, their other community partners?
Yeah, not as much these days. So I did used to work more with children and families. So, you might be talking to the teachers and the parents and all that kind of thing. These days, I predominantly work with adults that have, naturally have a lot more autonomy. And yeah, there's not as much need for that. But if I were to have that sort of contact, if it was an external stakeholder, not a family, it probably would be through Zoom. Yeah.
That's great. So again, let's talk about your big picture, where you want to be in next, let's say, 3 years. So what is the big vision for next 3 years?
3 years. I don't know, last year, for me, it felt like 10 years, so 3 years in the future, I don't even know what that will look like, but I guess for me, the focus this year and next year, I'm actually completing a PhD at the moment, so, I've got 2 more years left of that, so 3 years I'll be finished that, and it's very much in, I'll be looking at, neuroaffirming, uh, support for autistic individuals that are seeking, mental health care, predominantly with, interviewing autistic adults and allied health, professionals, so, but I guess in terms of my business, I think what I'm really wanting to lean into is more this supervision space, this training space, where and consultancy to organizations or people that are wanting to understand how to, um, I guess, deliver their service practice in a neuro-affirming way, neuro-inclusive way. And yeah, I guess that's really my passion at the moment, particularly with like allied health and like healthcare and mental health staff.
Okay. So, of course, I'm sure you might have some definitely short-term goals and of course these long-term goals as well. So in your understanding or in your thought process, what bottlenecks or challenges you feel you will be encountering uh, or accomplish your long-term goals, or what those challenges are?
That's a good question. I know, I think I'm someone, I'm very, I definitely see challenges, but I kind of I wait till I get there and then then I'll
Kind of
figure it out a little bit. There's some things you can foresee, but I've just learnt in life sometimes you just gotta go for it and then, figure it out as you go along. But I think for me, something that does help, obviously you want to mitigate risk. You don't want to be too silly. But I think having reliable scaffolds and structures and technology so that if things get really busy or really stressful or a bit, feeling a bit unorganized, those things are always there to kind of catch you or to support you moving along, towards your goals or with your business. As I said, like if it wasn't for technology and AI, I don't know if I would have been able to do everything that I have with my business. So I think for me, it's about setting those foundations so that I've got a solid ground to move forward with.
Understood. That's great. That's great that you are. So, do you have a just for the sake of understanding it more? Do you have? Are you a small group of people or a team or an individual that can help you purely on technical innovations and improving the efficiency of what you do in near future? Is this
Oh,
something your plan?
I would love that. That would be great. Yeah. I would like to have a team of people to work with. I think um it can be hard to find people that are very aligned. And I think when you're I guess for me, I'm so passionate about my work that I really want people to be, aligned moving forward. So I think a lot of the services that I am going to provide into the future will be online. And I'm not an IT expert. So there is a point where, I'm going to need support to be able to set some of these things up.
Understood. Understood. That's I think for planning purposes, it's very important because when we talk to many leaders in this industry, I think what they are doing is the people have a short-term plan and long-term plan, and they are if you wish that you want to have a technical help, I think it could be a good starting point if you have not already done some forecasting and some planning around that. Okay, that what you will need in 2026 to accomplish your this year's goal, how much budget or efforts you will need to accomplish your upcoming year's goal. So I think it could be a good starting point if you have not already done that, to put some forecasting and budgeting in place for these sort of additional help that will really in term help you
Mm,
patients.
yeah.
So, if you talk a little bit about your country's healthcare system, because I think healthcare system works a little bit differently in every region, every country. How well connected is Australia's healthcare system in overall? For example, if I give you an example of United States, so it's very connected healthcare ecosystem. So EMRs are connected with health information exchanges. They are connected with many other organizations. So in terms, the care is improving. So patient can get better care no matter where they are because of the interconnected healthcare systems. So how does this work in Australia, and what's your vision or dream for that is?
My dream. Oh gosh. So in Australia, um, health systems are state funded. So in terms of mental health care and mental health support, it's largely state funded. But in terms of care for people with disabilities, we have something called NDIS, which is federally funded. And Medicare. Now we have Medicare as well, which is federally funded. But like in terms of like our hospitals and all that kind of thing, it's kind of funded through the state. So I think in Australia, like compared to a lot of a lot of places in the world, we do have a pretty good healthcare system. There is some fragmentation, though, sometimes, particularly between the federal and state systems, which may not align. There might be arguments around who's going to fund what, and like particularly around elections and things like that. And there has been a lot of challenges, particularly with Medicare and NDIS, particularly after COVID. During COVID, there was a big increase for mental health support through Medicare, and then that was reduced. And also with NDIS, there's been a lot of funding reductions for folks there as well. So, I think overall, like a lot of people do have some access to mental health care or healthcare, even if you don't have private health insurance. But particularly when it comes to working with autistic people, there are definitely some challenges there because often they have many co-occurring challenges. So they may have disability, mental health, physical health issues. So you're often interacting with many many systems and many services.
So it's good to know that the system is in a good shape overall. But do you also, from a compliance perspective, there is also need for business owners like yourself to be integrated with government agencies or government organizations, or it's not mandated at the moment?
So yeah, I guess for myself as an accredited mental health social worker, so I am a Medicare provider. So I have to be a member of my accreditation body, and I have to maintain that and hold certain standards so that I can continue to provide rebates and things through that. In terms of NDIS, you can choose to be a registered provider or not. And I've decided not to be a registered provider because as a small business, a lot of the audits and everything can be quite expensive when you don't have like necessarily a lot of clients. But obviously we still have to maintain particular standards and, have qualifications and maintain our registrations as well. So yeah, I think, does that answer your question?
Yeah, absolutely. Absolutely. And I think one big area in healthcare is, of course, you need to be audit ready because it takes a lot of documentation. It takes a lot of administrative work for what you are doing. And it's another area where I believe AI is going to be great help in future as well, because there are some great tools out there that if you integrate with your they help you a lot with creating compliance ready documentation. So
Yeah.
again, AI it can be one of the things on your roadmap for future that you can adopt. And of course, this will help you with compliance with regulatory requirements and certification and integrations.
Yeah.
So, um, and I will ask you my favorite question now, because we are in almost the last segment of our
Yeah.
discussion. Passionate about that. So, as I said, a lot of our viewers are either C-level executives or somebody who is trying to start a business in healthcare. So they
Yeah.
listen to professionals' advice and experiences and learn from that. So, if
Mm.
you have to give advice to somebody who is thinking to start a business just like yourself in any part of the world, what that advice would be?
Oh gosh, that's a good question. Oh, so many things. I think number one, you need to be passionate. Because, when you're working in healthcare, it's not always easy. It can be stressful. You can be doing a lot of unpaid work. You can be advocating for people in really challenging circumstances. So I think if you have passion, passion for what you do, it will hold you through a lot of that, and that will help with the longevity of yourself, as a business owner, but also to continue with your business and your practice. Um, because I think, no matter how hard things get, um, if you can still, I guess, have a bit of a smile or a bit of a drive, or, that kind of feeling that you get when you get to be a part of something that you really enjoy. I think that can, really pull people through.
Perfect. Thank you so much for this powerful advice, and thank you so much. I really enjoyed our conversation. I think we talked about many important areas: your passion, your experience, where you are looking ahead for next couple of years. And I think one thing that really stands out from our performance is our discussion is that you are really looking use more and more technology, which is, of course, as we were talking, that there is a little bit uncomfort out there in not only in general public but also in leaders as well about adopting AI and being little bit skeptical of the security side of things. But I think you are on the right track in adopting that, but with right calculations and taking the right amount of risk in mind. So that's really something that I think is making you stand out. And of course, this thing will help you a lot in growing your business. So I really had a great conversation. I really enjoyed it. If you have any question for me, please feel free to let me know.
Yeah, great. Thank you so much.
Thank you, and have a good rest of the day.
You too. All right. Bye.